Okay, so I wanted to talk to you about memberships in professional nursing organizations that you may hold and the benefits of those organizations and what those organizations do.
Okay. I'm a member of two professional organizations. The one I've been the member of the longest is the National Oncology Nurses, well, actually three, National Oncology Nurse Society. And then I'm also a member of Central Florida Oncology Nursing Society, which is based out of Orange County. That's where I work, so everything is based out of Orange County. Oncology Nurse Society, it employs nurses with oncology backgrounds to kind of come together, understand each other, and you seek rules, regulations, laws that's going to better help our oncology patients, and studying ways, making sure that we are always grounded in doing things that are evidence-based when it comes to treatment. Not just out there doing something, but make sure it's been evidence-based and there's reasoning behind it and rationale.
Okay. And then what about the other organizations?
And then I'm also a member of the American Nurse Association. American Nurse Association, I kind of joined that when I was in nursing school, so I just kind of kept up with that. Not that we do anything in particular, not that I do anything in particular with them. I do receive the monthly periodicals, so I keep up with those because they always have good material in there for reading anything you have a question about. So, and then sometimes it's just good to be a part of whatever you do in your professional life. It's always good to have some type of professional association tied to you, so that helps you grow. And I believe that when you follow people that are doing great things, you yourself will in turn do great things.
I absolutely agree with that.
And then my third one is Black Nurses Rock. I'm a member of Black Nurses Rock, which is a national organization where our goal is to improve healthcare disparities in impoverished or minority communities. But it's also teaching the nurses to level up, so to speak. You work with nurses that are leveling up, and you do the same thing. Just increasing the knowledge, increasing the power within the community, within the agencies, and just making a difference in the patients' lives. Our initiatives right now are HIV, diabetes, hypertension, heart disease, and stroke. Mainly because we're a Black nurse, founded by a Black nurse leader. However, it's not just for Black nurses.
Right.
Because if you look back at history, 40, 50 years ago, a nurse could not join American Nurse Association.
Right.
We could not do that. So, as a matter of fact, as a result of that, ethnic communities had to go out and form their own. So that's how they're still into play. But it doesn't mean that we don't welcome anybody else. It's just that's just the name of it, and that's the history, because you can't erase history.
Right.
History is what it is.
Absolutely. So, looking at theoretical frameworks that are used to guide practice, what are some theoretical frameworks that you use?
I think having self-organization, that's a good thing. And that's pretty much, and I'm going to read that description for you. Okay. It's just the structure of the human being demonstrated by pattern and its manifestations. So you've got to have your things, your actions into place and know how to carry it out from A to Z.
Right.
I think that's very good. I like the energy field. I mean, you have to have, I think you should have display a level of energy in whatever you do, but also bringing that to the table when you're taking care of patients and delivering care.
Right. I definitely think that kind of ties into the care delivery model that Orlando Health has, the synergy model, where the patient is the center of the care, but we are there with them and we are interacting as a whole. Making sure, like you said in the Letty's human energy model, that the energy field and awareness of the environment, making sure that their needs are met when they go out into the community. So I think that's a great model to follow for you, for that position in particularly.
It's so important to have that relationship between the nurse and the patient, and just kind of bring it all together, even with the family, whoever's in charge of that family. You got to bring it all together. It's all about collaboration.
Right. Okay. So discussing nurse values, what are some nursing values that are important to you in this career?
Okay. I think one has to be, when it comes to a value, and sometimes you can look at value as far as being what you may think personally.
Right.
But you've got